Tonight is the American Heart Association's Northwest Ohio Heart Ball. The event celebrates the year-long efforts to create a community free of cardiovascular disease and stroke. Kaylee Marentet joins us live from the Hilton Garden Inn in Perrysburg. Kaylee, what's tonight about?
Hey Mel, we're about an hour from doors officially opening here for the Heart Ball. I'm joined by the chair of the Heart Ball, Carly Salamone. Carly, thanks for joining us here tonight.
Yeah, happy to be here.
Yeah, so big event here we've got going on tonight. What is the whole purpose of this? Obviously, we're going to raise money, but what else is tonight about?
Yeah, tonight, just like you said, it's about raising money for the American Heart Association and research for heart health and heart disease. It's also about raising awareness for our rural communities and the disparities that exist around heart disease, raising awareness of the services that they provide, and raising awareness of the research that's happening right here in Toledo that money from the American Heart Association directly impacts.
So this is a big role that you've taken on, being the chair. We were talking about it. It feels surreal that the day is kind of here already. Why did you decide to take on this role?
Yeah, absolutely. So in my role as president of Vantage Healthcare of Ohio, I work with independent rural hospitals all around the region. And initially I took this on as an opportunity to raise awareness of the services they provide. We're going to have a survivor talk about their experience with one of our community hospitals tonight. And then after a little bit, I realized I also have a personal connection, right? We all have a personal connection to heart disease and all know someone who's been impacted by heart disease and stroke. So it's become a huge passion for me to raise funds and get to a world without heart disease.
I think there's a lot of misconceptions around heart disease too, and people that have cardiovascular issues that you have to be unhealthy when in reality anyone could be susceptible to it.
Absolutely, yes. Genetics play such a huge role in cardiovascular disease, and that's why it's so important, regardless of how healthy you are, how frequently you exercise and what you eat, that you're going and getting checked regularly by your doctor, that you're getting testing done, that you know your health history and your genetic history, because it can be you who has a heart attack or a stroke without any other symptoms.
All right, Carly, thanks for joining us here tonight. We'll see a lot more of you here in the coming hours. Again, doors open at 6 o'clock tonight. We have some of our other WTOL 11 family members coming here. We'll have an update coming up at 6 o'clock. Reporting live in Perrysburg, Kaylee Marentet, WTOL 11.